Good morning, everyone, and thank everyone for joining us this morning. I'm sure you're joining me and eagerly anticipating opening next week of a number of aspects of the economy again. No one more so than me. Haven't had a beer in nearly 4 months, and I'm really looking forward to it. So hopefully I'll be visiting a few of your establishments over the course of the next week. So this morning we've got colleagues from Environmental Health and Trading Standards, and they'll be looking at how we work with the hospitality sector to ensure a successful and safe resumption of trading. The approach will continue to be based on the 4 E's that we had previously: engage, educate, encourage and enforce, and with enforcement obviously being reserved for occasions where these other measures have kind of not achieved the compliance that we were expecting to see. The webinar is just one of a number of initiatives to try and engage with yourself. We're obviously really keen to try and help support you get back up and running and open and trading again. We'll be sending out some emails summarising the requirements and keeping the website up to date, so please keep an eye on our website. And businesses looking for support and advice can obviously contact us via the website, and we'll obviously endeavour to kind of contact you as soon as possible. We are obviously expecting quite a number of inquiries over the next week or so, please bear with us as we try to get around everybody. Officers will also be undertaking proactive visits to premises from Monday, as well as responding to intelligence and complaints regarding poor practice. Visits obviously will be conducted throughout the working day, as well as during the evenings and the weekends. So try and give you a bit of background context and a bit of an understanding of the kind of guidelines and everything that we're now been issued. We've got a number of speakers today. So our first speaker is Alison Robertson, and Alison will be identifying the new and changed requirements since trading stopped at Christmas, as well as highlighting some of the most significant requirements to keep on top of from your own perspective in terms of running your business. We'll then go on to Jenny Strachan from NHS, and Jenny will give us a summary of why the physical distancing remains a vital control. And then finally, we've got Neil Campbell from Police Scotland. Neil will be going through highlighting the kind of joint enforcement work between Police Scotland and Environmental Health and Trading Standards. I've kind of noticed that there's already some questions coming into the Q&A session, so please continue to add to any questions that you've got. If we've got time at the end, and obviously if we can, some of those questions already are quite technical, we'll try and cover some of those off. But what we will do is take all of the questions that are posted today, and we'll put all of them into a kind of Q&A sheet, and we'll post that on the website with a link to the answers, and we'll email that out to you also. If we don't answer your question directly today, either because of time or because of the technical nature of the question, please be assured that we will take all of those questions and provide answers. So straight to it then, I'll hand over to Alison, and as I say, Alison will kind of go through some of the major requirements of trading stock, and obviously the key things that you need to keep an eye out for as we move forward. Alison, over to yourself.
Thank you, Steve. Good morning, everybody, and welcome to this latest hospitality sector seminar, reopening our hospitality sector safely. Next slide, please. Okay, so there's, as you all know, and you've been eagerly awaiting, there's substantial changes to the COVID rules from Monday, the 26th of April. And from that date, all of mainland Scotland will move from level 4 down to level 3. Just as an indicator, there'll be a possible move down to level 2 across all of Scotland on the Monday, the 17th of May. And that will include further reopening of hospitality, and where circumstances permit, if the cases remain low, the Scottish Government's intention is to move to level 1 on the 7th of June and hopefully moving to level 0 in late June. Next slide, please. Okay, so what the rules within the levels are, I'll just quickly go through that because we've got a lot to get through. Level 3 we're going into from the 26th, and that will be alcohol permitted outdoors. Local licensing laws apply, maximum 6 people from 6. Indoors, alcohol not permitted, closed It's 8 o'clock indoors, maximum of 6 from 2 households indoors. I won't go into too much about the level 2, 1 and 0. I just thought I'd put the slide up there to let you see it. The slides will be available following the webinar. So it's just to give you a pointer that's in there. Okay, next slide, Sandy. Okay, so what does it mean for the hospitality sector from the 26th of April? The hospitality premises such as cafes, pubs, restaurants can reopen indoor and outdoor areas on a limited basis. This also includes the reopening of indoor attractions in public buildings, galleries, museums, amusement centres, licensed bingo halls, casinos, fun fairs, etc. Collection of takeaway food indoors will be permitted from Monday, so there will be no longer a need to serve food through a open hatch at your front door. You'll be glad to hear. Outdoor area opening hours will be determined by local licensing laws, and alcohol can be served outdoors, we think, until about 10 p.m. with a 15-minute drinking up time. Groups of 6 from 6 different households are permitted to meet indoors, in outdoor public spaces, beer gardens, outdoor seating areas, etc. The limit at wedding receptions will increase from 20 to 50, so that will be relevant to a lot of the hotels, etc., and premises that hold such events. The reopening of indoor attractions in public buildings, etc., as I said. Yep, next slide, please. So the rules for hospitality indoors are different due to the increased risk of airborne transmission. This is why there is no alcohol being allowed indoors as yet. But the cafes, pubs, restaurants can reopen indoors until 8 p.m, albeit with no alcohol served. So up to 6 people allowed to meet indoors in public places, hospitality settings, and a maximum of 2 households at this time. Physical distancing requirements remain unchanged. 1 metre is allowed with mitigating measures in dining areas, but all other areas still 2 metres. So in premises, for example, the dining area of a premises with mixed use, maybe got amusement arcades or what have you, or a casino, etc., with the gaming areas. The gaming areas would be 2 metres. The dining areas would remain at 1 metre, as long as there's the additional mitigating measures in place, which would be your face coverings, sanitising hands, robust cleaning regimes, etc. Next slide, please. So long-awaited tourist accommodation and travel will be opening from the 26th of April. Hotels, guest houses, etc. can still reopen. However, self-catering accommodation rules on indoor meetings still apply until the 17th of May. So 2 households can't yet stay in the same self-catering accommodation. So maybe all have to wait for a weekends away with our friends at the moment. But good news, all remaining travel restrictions will be lifted for travel anywhere in Scotland and for travel between Scotland, England and Wales for any purpose. So it's just to give you a highlight there that you could have an influx of tourists, which will hopefully be coming to visit your hospitality premises. Next slide, please. Okay, as I've said, the existing mitigating measures will still apply. Every premises should be doing a COVID-19 risk assessment. If you haven't already done one, I would advise you to get one done as soon as you can. If you're struggling with that, let us know and we can guide you through that process. We don't want any premises struggling on their own, and would prefer to hear from you rather than come across you through inspection or receive a complaint. So be proactive and get in touch with us. We don't bite, honestly. Table service is required. All customers seating. There'll be no standing at bars, no standing at premise, indoors or outdoors. Remember your hand hygiene, hand washing and hand sanitising is still essential, as is robust and regular cleaning and hygiene arrangements, managing toilet facilities, etc. Improved ventilation. Ventilation is really important, and I'll come on to that. Again, workforce planning, ensuring that you're staggering your teams, not everybody's coming in at the same time, reducing build-up of people within your staff changing areas, etc. And again, crucial to train and update your staff on the new changes. Other key areas just to mention is your premises has probably been, have been closed for some time. Some businesses may have been checking the premises for Legionella, but just remember to look at your water storage and check for Legionella. If you're not sure about that, again, get in touch with us and we can give you some advice. Update your food safety management systems. If there's been any changes, we'd advise you to review these, given that premises have been closed for some time and there has been changes. Fire safety, is all your exits, fire safety exits clear? Can you still get a safe means of escape? And security of your premises. Will just do a check round. Can people get access to other doors that are not manned? Maybe you need to review your security arrangements, so just have a look at that. Next slide, please. Okay, Scottish Government has updated the collection of customer contact details. So there's a new requirement for all hospitality venues to record the details of all of their customers. It doesn't apply to customers collecting takeaway food. This was just the head of each group or each household in a group, I should say. But they've changed that to record all details of all your customers, not all your customer details. It's just your name and contact number and rota information for staff and name and contact numbers for each customer, for customers and visitors. You don't need that for takeaway food customers, as I've said. Okay, that should include also the date of a visit, arrival time, and where possible, departure time. This is to assist, test and protect, and will help to speed things up in the event of any outbreak affecting any premises. You should ideally also record table numbers and sections where seated if you can. This also helps test and protect. The more information that the more controls you've got, the more information you can give to test and protect, the less time your premises should be closed or closed at all if you've got the controls in place. If you've got no telephone number available, take a postal or email address and retain the details securely for 21 days and dispose securely thereafter. Remember about if you have an electronic system, remember the GDPR requirements to register with the the information officer, and more information can be given on that if you need it. Next slide, please. Okay, so hospitality businesses are still required to have regard to the following statutory guidance health messages. As before, it's still have to be mindful, and we would be taking that into consideration as well if we received any complaints, etc. So it has changed slightly since the last time. There's still a mandatory collection of contact details, but now that is strongly recommended for collection from all customers. Your queue management, trying to minimise queues indoors and limit outdoor queues. We should be more focusing on the seated table area for managing the ordering, consumption and payment process. That's the most important thing. Queue management, minimising queues outdoors. We really don't want to see people queuing all the length of Union Street or any other street in Aberdeen and waiting to get into premises. Noise control has changed, you'll be glad to hear. Low-level background music is now permitted, but premises still require to manage the noise. Loud behaviour, shouting, singing should be challenged, and customers advised to reduce that. This can be also communicated to your customers through signage on your website, social media, etc. So just have a think about that. The Scottish Government guidance, which was issued on Friday there, gives you some information about noise control, about low-level backgrounds. Each premises considering this should be undertaking an exercise to set their background audio level, and there's a method detailed in the Scottish Government hospitality guidance on that. Again, if you're struggling with that, let us know and we can give you some pointers and advice and guidance on that as well. Next slide, please. Okay, physical distancing and managing capacity. You need to make sure that there's no crowding in premises. It's still in the regulations to admit people in only sufficiently small numbers to make it possible to maintain that distance of 1 metre and 2 metres in premises, and all must be taken into consideration when determining a maximum capacity. There is draft guidance on calculating and displaying a maximum capacity in the Scottish Government website if you follow the link on this slide. Next slide, please. Okay, I'm now going to hand you over to Andy Morrison, our Protective Services Manager, and he will give us some explain the next 4 slides. Thanks, Andy. I'll hand over to you now.
Okay, thank you, Alison, and good morning. I thought I would come in and just talk through these slides, which look a little complicated to start with. From recent media stories, it appears that there may be some confusion regarding physical distancing requirements between households within a single group. All households are required to maintain 1 metre distancing from other households, and this is not a new requirement. This has been in place for a significant period. What is new is the fact that we are now allowed up to 6 individuals from up to 6 households. Much simpler to organise the physical distancing when it was just the 2 households. So, to put simply, the more households in a party, the bigger the table requirements will be to accommodate them. So what we've got here is a table identifying for a party of 6 the various dimensions that will be required to accommodate the various types of party. For round tables, it is just the party size. The makeup of that party doesn't change. However, unfortunately for rectangular tables, how that party is constructed will vary the size of table that would be required to accommodate them. So, for example, a party of 6 individuals from 6 households, which is the top left diagram there, would require a table of 3.5 metres in length, whereas the same party made up of a group of 3 and 3 individuals would require a 3 metre table. Next slide, please, Sandy. This is taking the same things going through the lower groups, and we've got the same going down all the party sizes. So as you can see, it's unfortunately quite a complex operation to identify how you are going to sit various parties that come into your premises, and the information you're going to require is quite detailed. Again, next slide, please, Sandy. Yeah, so this is taking it down just to the base levels, where it gets much simpler, and again, the size of tables becomes much smaller and easier to accommodate. Next slide. This is the same information, but this time formatted on the basis of table size. This will allow businesses to identify what groups they are able to accommodate in which tables. It is a complicated area, and I apologise if this has been a rush through, but Alison has said if you want further information, please contact us, and you can contact us via the website, and I'm sure there will be questions on this, as it seems to be possibly one of the most contentious issues. Okay, Alison, back to you.
Thanks, Andy. Next slide, please, Sandy. Okay, as I've said, increased ventilation is really important. It's one of the key measures that we've now got. We're now aware since last year that that COVID-19 can be transmitted through airborne particles. So it's really, really important that the ventilation is sufficient in premises. You can maximise fresh air in a space by natural ventilation, so opening doors, windows, air vents, and by mechanical ventilation. We'd advise you to check your mechanical ventilation so that you're taking outdoor air in and you're not recirculating air through the building, which a lot of air conditioning units can do. A good idea to improve your ventilation is to purge your premises, purge rooms before use. So if maybe when you come in first thing in the morning, open all the doors and windows that you can to get as much fresh air as you can. And in between shifts, if you're closing a part of the day, if you can, keep doors and windows open, obviously, if you're in the premises, but there's obviously security issues as well if you're not there. So keep, I mean, we have still got cold weather, that'll continue in Aberdeen forever. So you need to advise customers, not customs, through websites, social media, signage, etc., to wear warm clothing. So the ventilation is really important. It's also important to ensure if you've got a lot of barriers up and allowing the 1 metre mitigation measures, that you're not kind of blocking ventilation. Although you're putting in barriers to as a mitigating measures to stop the spread, if you block in too much, then you're going to reduce the ventilation, which is going to add to the risk of transmission. Okay, next slide, please. Okay, I've just put together here some further guidance and source of advice. I won't go into that, but it will be available, as I've said, after this. So have a look at the Food Standards Agency website, sorry, Food Standards Scotland website, HSE. Definitely look at the Scottish Government COVID-19 tourist and hospitality sector guidance. There's a lot of good information. It just came out on Friday, so we're still getting to grips with it as well. There's a checklist for businesses that you can print out and use, and we would advise that your staff are trained on this as well. Okay, next slide, please. Just and finally, and this means it's my last slide, you'll be glad to know, just to say that the virus is much more infectious since hospitality last opened, so we still need to be cautious. COVID-19 is still here, it's still circulating, although at much lower levels, and we need to continue to be careful, take all the required precautions, and this applies to us all. Remember the facts. It remains the most important first line of defence to help to protect ourselves and others. Wear a face covering, avoid crowded places, clean your hands, surfaces and other, clean your hands, clean surfaces that you and others are touching. 2 metre distancing remains an important defence, and self-isolate and get tested if you have symptoms. We need to all work together on this, and this is businesses, members of the public and us here in protective services, and if we do that, we can hopefully successfully reopen our hospitality sector safely and keep this virus at bay. And thank you for listening today. I'll hand you back to Steve now Thank you.
Thanks, Alison, and thank you, Andrew. That was really useful for even just from my perspective to kind of understand the position as we go into the reopening next week. So I think the key thing for me there was that obviously a lot of the rules and regulations are continue to be the same, but there are some slight changes there. Probably, I think the ones I picked up there was obviously the capacity notice for premises, and obviously the good news, we can now get 6 households into premises, but there's an added mathematical complexity to allowing 6 households to come into premises. But I'm sure Andrew will be able to kind of give you all the permutations and details if you need those. So thanks to both of you for that. I'll now hand over to Jenny from NHS, and as I said earlier, Jenny will kind of give us a bit of a summary on why the physical distancing remains a vital control in the battle against the pandemic. And so over to you, Jenny.
Hi there, morning everybody. I'm Jenny. I'm one of the health protection nurse specialists with NHS Grampian. I don't want to say a huge amount this morning because what I have to say is that Alison has covered really well and a range of obviously all the different measures that you're being asked to follow and why they're so important. I think I just want to reinforce that obviously we're really happy from a perspective that we're able to reopen some of our services again. I appreciate this has been a hugely challenging and difficult time for all of you out there with your businesses and things, and we really don't, from a health perspective anyway, underestimate how difficult that has been for you. So thank you for continuing with that support. I guess I don't want to be the bearer of bad news, but I guess what I need to also say from a public health perspective is that basically what Alison was saying, this pandemic for us is by no means over. I know the kind of media sort of perception that is out there and with all the messages about reopening is that maybe we're out of the woods now and that actually things are okay and we can all get back to normal and just kind of get over all of this. And I know we're all sick to death of all the messages, but sadly that isn't really quite the case. Thankfully in Grampian we are continuing to see low numbers of COVID-19 infection, but we are still seeing outbreaks. So what we're seeing, as Alison was saying, is that when this infection, the COVID, gets into a setting, for example, I cover workplace settings, so when I see that COVID gets into a workplace, it can be as few as 1 or 2 cases, and before you know it, it has spread throughout quite a significant part of the workplace, and that's even with good control measures in place. So it is hugely infectious, as Alison was saying. And with the kind of easing of restrictions that we're obviously all going into, the lifting of lockdown, we are very much being predicted that we will have a further 3rd wave at probably around the end of the summer. And I know that maybe hasn't been in the news as much as it maybe needs to be. So I just want to make you all aware of that. And just to basically say, because of the fact that we're predicted to have this 3rd wave, I can't stress to you how important it is that we continue to work together and continue to follow all of the control measures that you're being asked to follow. You know, for our perspective, the longer we can push back this 3rd wave, the better the health outcomes, the more time we have to vaccinate people. And the only way we can push back this 3rd wave is by, as I say, following the control measures. I guess the other thing that I just want to touch on from a health perspective is with the introduction of the vaccine that we wouldn't have had the previous time that you were kind of reopening. We're seeing that a number of people who are vaccinated, be either partially or fully vaccinated, have got the idea that the vaccine gives complete immunity and that they now almost have superpowers when it comes to COVID-19. And again, I just want to stress the importance of, yes, obviously the vaccine is an absolutely crucial part of our public health kind of control measures. And yes, obviously it's of huge benefit. It will, you know, much lesser, it will attenuate the virus, so it will give you milder symptoms, and it should obviously help in terms of the clinical outcomes greatly. But what it doesn't promise is that it doesn't mean that you can't still catch COVID-19 and you can't still potentially pass it on to somebody else. And it's really, really important that people understand that, and they don't think that because they're vaccinated, they don't need to follow all the control measures that we've outlined already today. So I think they're the kind of key messages for me. You know, as I say, we're really keen to get everybody opened up again. There's obviously a range of different benefits in doing that, but I need us all to continue to work together, please, and support each other so that we can, as Alison says, do this safely. So I won't go through all the control measures again. Alison's, as I said, outlined them really, really well. I do appreciate they're not going to be easy for you to implement. And I guess I just want to stress, as Alison said, we're all here to support you as well. If you have any questions from certainly a health perspective, or if you get a case of COVID-19 in your workplace and one of your employees, please do feel free to get in touch with us. We are here to support you. And there's no sort of pointing fingers. It's not about blaming people. It is about how do we, okay, we know we've had a case, how do we look at controlling that and trying to stop onward transmission? Okay, so yeah, please do get in touch with us if you need support, and thank you very much. I'll pass back over to Steve.
Thanks, Jenny. That was actually quite interesting from a personal perspective there. I am partially vaccinated, so it is interesting to hear that I don't have the superpowers that I actually thought I did have, and that I still need to be careful and ensure I kind of continue to follow the kind of facts, and making sure that I keep my social distancing and stuff like that. So that was actually quite an interesting point, because I have been kind of wondering actually, the whole vaccination thing, what does that mean? So that's been quite interesting for me to hear that actually, and hopefully others took the same. Our final speaker is Neil Campbell, who's an inspector with Police Scotland, and I'll hand over to Neil, and he'll complete the final part of the presentation today.
Thank you for inviting me today to your webinar. I'm delighted that the hospitality trade's opening. We've been linking in with environmental health and trading standards to try and get a joined up approach from a policing perspective, ensure a smooth opening of the hospitality trade. Basically, I'm here today to try and reassure the hospitality trade that we're looking together. We're looking to work with the licensing trade, get premises up and running and open as soon as possible and as smoothly as possible. Obviously, as per in the previous lockdown and the easing of restrictions, we engaged with the 4 E's as well: the engage, explain, encourage and enforce. From a policing perspective, our first course of action will be if there's an issue or problem identified when we're visiting premises or it's highlighted to us, the first course of action will be to highlight it to the management and staff in charge of the premises and seek for them to take remedial action to ensure that premises are operating as safely as possible. From a policing perspective, starting on the Monday the 26th, and over the coming weeks, we'll be carrying out joint visits with our colleagues from environmental health and trading standards, as well as just ourselves, to ensure that premises are working well and running smoothly. There will be a regular occurrence, there will be regular visits, but I just want to reassure the hospitality trade that hopefully by working together with us, we can all make the recovery of the hospitality trade as smooth as possible. Similarly, if there's any licensing issues from a policing perspective, like the others, we're more than happy to take calls at our office. If you phone the police contact number and ask for the licensing department, we would be happy to provide you with guidance and assistance as necessary. And that's pretty much it from me, and I'm happy to hand back to Steve.
Steve, I've muted you, you have to unmute.
apologies, that's one thing I was told not to do before this started, so I failed. So no, thank you, Neil, for that. That was really helpful. I suppose just from my perspective, it was quite. Hopefully, you've got the message that we're trying to kind of work in a joined up way with the police and NHS and the council, and hopefully we can all work together and let's get the hospitality trade back up and running, because it's been certainly sorely missed in the city. We've obviously been getting a number of questions that have been kind of coming in, and as I said, we'll maybe cover a couple off just now, but we'll certainly put up a full list of Q&A for everybody to be able to kind of sort of see. So if you haven't, if we don't ask you a question, please wait till we send the email out and you can obviously get a full update. One of the interesting things there, I think I was hearing, was around the hospitality sector being able to now play, I think we described low-level music, and I suppose I was just thinking, you know, we've got the Euros coming up, possibly the cup finals that will be televised live and everything, and I just wondered, maybe Andrew Morrison, can hospitality show live sports events as well as the kind of low-level music, or is there something distinguishing between the two there?
Yeah, no, sporting events can be shown on television. The volume still needs to be kept low. The primary purpose should still be the hospitality. The football or whatever the sport is should not be an event. It should not be the occasion, so it should not be the big draw to the premises at present. Clearly, as we move forward, we're going to have to look at that in terms of the Euros, because clearly that is an event in its own nature, but we will be obviously looking to provide further advice before that time. But yes, sport can be shown.
Okay, thanks for that, Andrew. So it's handy to know that there will be a little bit of ambient noise in establishments going forward from Monday. So that's kind of interesting to hear. I suppose just as well, I mean, in terms of obviously everybody kind of opening next Monday, what's the kind of plan from the kind of environmental health teams perspective in terms of engaging, going out, etc., etc. Just again, so people are kind of aware. You know, are you going to be kind of going out and visiting premises from Monday, or is it, you know, by appointment only kind of thing? Maybe Andrew, you could maybe just give us a bit of thought around what you're kind of planning for next week.
Yeah, well, thank you, Stephen. As Neil mentioned, we will be working with the police in relation to this. We will have officers out doing proactive visits to the hospitality sector, as well as keeping an eye on all the other sectors that are opening up on Monday. Hospitality is only one area of many that are getting to open. We'll have officers on the street. We will also be doing visits evenings and weekends to help assist. We will have officers able to respond to queries coming in via our website, and we'll also be dealing with complaints and any intelligence of non-compliance. We'll continue to aim to deliver a 4Es approach, you know, primarily relying on engagement, education, and encouragement, with enforcement only being reserved to those occasions where we cannot get the necessary improvements through other means.
Okay, thanks, Andrew. That's good to know as well. You guys will be out and about next week, so hopefully you'll see a visit, and any kind of questions you'll be able to kind of get direct access if they're out and about. Another question, actually, maybe more for Jenny from the NHS side of things. I mean, Jenny was kind of indicating there that a third wave is kind of almost inevitable. I suppose in my mind, I'm kind of sort of thinking, with the number of people that have had the virus, the number of people now in the UK, or certainly Scotland, that have been vaccinated. But I suppose just trying to understand, why do we think a third wave is inevitable? And obviously that would clearly focus our mind to understand how we have to make sure that we are continuing to kind of comply with the guidance and all that kind of social and physical distancing. So maybe Jenny could maybe just give us a little bit of background on that.
Yeah, I mean, whether inevitable is too strong a suggestion, but having said that, I mean, obviously this is all data that follows modelling, and it comes out from the UK government, and We obviously have our own people, sort of Grampian, who are also in health intelligence, give us sort of weekly and monthly updates in terms of that. And yes, I mean, there is no doubt a third wave is predicted. As I said, when exactly it will happen is hard to say for sure, because it will really depend on how we go over the next few weeks in terms of the lifting of restrictions. I think it's slightly inevitable because we do still have pockets of the population who won't have had natural infection, therefore they are vulnerable to getting COVID. We obviously do still have quite a significant proportion of the population who are maybe not vaccinated. Now, they're not obviously the most vulnerable, because we have vaccinated the most vulnerable, and we continue to go through our vaccination programme in terms of priorities and trying to get as many people vaccinated as possible. But with the lifting of lockdown and the lifting of restrictions, you know, even with the best intentions and even with all the good control measures being followed, it is inevitable that we will see spread of COVID. You know, we've seen it when the schools have reopened, for example. We see it each time that there's a reopening of services and of sort of settings. And obviously we also have things that we've got to be keeping in mind from a public health perspective, like foreign travel, like potential new variants of the illness. As Alison said, this variant that's circulating right now is very infectious. So although we might have relatively low numbers of infection, it doesn't take a lot of those cases to come around for that to quite quickly increase and turn into an outbreak. So I think that's where the third wave kind of comes in. I think the good news in terms of the third wave that we were predicted is that it should be quite a sharp wave, but hopefully over fairly quickly compared to the previous waves. But it will come on quickly, and it will be quite a steep incline, is what we're being told. So as I said, the longer that we can push that back, the more people we can get vaccinated, the absolute better in terms of the health outcomes. Does that cover that, Steve? Is there anything else?
No, that's really interesting. Thank you, Jenny. That was helpful. So I think we've answered a few of the questions that were kind of posted, and as I said a couple of times already, we'll take all the questions. We'll go away, get all the answers and everything, and we'll get that up on the website as soon as possible. We'll send an email out, obviously, to everybody with a copy of the slides that you've seen today. I think there is a hyperlink in the presentation for contacting ourselves. But in the meantime, if you want to obviously contact us, please do so via the website. That was all I was going to kind of sort of say to sum up, other than to thank the various speakers this morning. Very useful to hear all of that, and I suppose just like to wish everyone a successful opening next week, and hopefully you'll be able to kind of safely open, and you'll see a packed, physically distanced style premises from Monday, and hopefully I'll see you all again at some point in the future. So thank you very much.
Thanks everybody for attending.